Welcome to Season 1, Episode 18 of the Home Health Care Today show. I'm your host, Dr. Cleamon Mora. It's November. November is National Home Care and Hospice Month. So this episode, Season 18, we're going to have a two-part segment with a very distinguished set of guests. So we're going to have a local dignitary on our panel, as well as a great conversation with the current president of Michigan Home Care and Hospice Association, Mr. Barry Cargill. Let me tell you a little bit about MHA, Michigan Home Care and Hospice Association, and Barry Cargill. So MHA is the state trade association representing businesses providing medical and non-medical care in the home. Member agencies provide services for home health, hospice, palliative care, home medical equipment, pharmacy infusion, and private duty home care. For the last 30 plus years, Barry Cargill has been very active in the public space as related to advocacy and policy. Barry, welcome to our show today.
Thank you, Dr. Moore. So happy to be here today.
Thanks for coming down, Barry. So, Barry, let's get into more about you. Talk to us about this passion that you've been able to sustain over the last few decades for home health care, for hospice, and for people in the state of Michigan.
Yeah, well, my passion comes in advocating for issues at the legislative and regulatory level, working with government agencies, working with legislators in order to adopt public policies that help advance home care and hospice.
Very good.
Yeah,
awesome.
It's been a lot of fun. I've been in this for about 30-some years,
Yes,
and seen a lot of changes during that time, and the biggest change is really within the industry.
Absolutely.
We're moving into an industry here in home care and hospice where
Yes.
lots of new opportunities are available, and we're finding that if given a choice, those patients and families want to stay in their home.
Yes, they do.
For as long as they can.
Absolutely, Barry. Yes, Barry. So for our listeners and our viewers out there of the Home Health Care Today show, when we talk industries, right, and associations, of course, those industries and the association leaders within industries, such as our industry, home care and hospice, have member organizations. So American Advantage Home Care is a member of the Michigan Home Care and Hospice Association. With that being the lead there, Barry, let's talk more about MHA, right?
Okay.
Yeah, so in layman's terms for people out there, that aren't a current member or a member organization of MHA, what is MHA? Talk about its history, its mission, some of those, I guess, core values, and the vision that you have for MHA.
Oh, what a great opportunity.
Yes.
We've been around since 1981, and the organization was established first when Medicare created the home health benefit under Medicare. Mm-hmm. And that was really our start. Prior to that, there may have been private insurance companies, but generally, people were on their own in terms of as they were aging. And of course, if you look back in history, you'll see that people didn't live as long as they do today, and that is certainly one of the changes that we're seeing. But as the organization grew, we started out there early with just home health. Mm-hmm. It wasn't long after that Medicare created the hospice benefit, for those who are 65 and older on Medicare. And also home medical equipment suppliers became a part of our association. There was an association of home medical equipment suppliers who in I think it was 1981 merged into MHA, and we became the state trade association for not only home health but also for hospice and home medical equipment suppliers. Over the years, palliative care became an important service, and it now is one of the evolving services. as we move on, cancer treatments and other things, are a very important part of keeping people healthy and safe in their homes. The other really neat thing about this has just been people want to be at home. If given a choice of where they live in their senior years, they want to be at home for as long as they can. And so the industry has evolved into essentially the solution to keeping people at home.
Sure has, Barry.
With the association, I think a lot of people are familiar with associations. There's associations for just about every industry that's out there. We're like the Chamber of Commerce for home care and hospice agencies. I think is the best way to describe it. And as an organization, we spend a lot of our time and resources providing benefits to our members through a collective voice to advocate for our industry. And we do that by establishing strong trust relationships with our elected officials, with our regulatory agencies at the federal and the state level. I know Congresswoman Dingell is going to be one of your guests here today, and she's been extremely helpful in advancing this industry, and much of that advancement comes with what people want as a changing market, but also getting the rules and regulations out of the way and adopting those rules and regulations in such a way that the industry is able to grow and to provide the things that seniors and individuals who are disabled need in order to stay in their home and out of the hospitals.
You got it, Barry. And Barry, I could echo your sentiment. I know firsthand as a leader of a member organization of MHA, the rich tools, the education, that committees are able to offer us, as members on a monthly basis. The policy, calls as related to insurance, right? So prior to our commercial, Barry, I do need to open up somewhat of a can of worms, right? I know we focused a lot in the conversation so far about seniors and providing care for homebound seniors and disabled and chronically ill. But those that were injured, right? Injured in auto accidents, right? Some of those patients are served by private duty companies. Some are served by public, or the public entities, the not-for-profit skilled agencies. And then some have care through attendant care types of agencies. Barry, prior to our commercial, as I open up this can of worms here, talk a little bit for our listeners and viewers about what's going on now in that auto no-fault space.
Wow. A lot is going on in that space. And I think for the average policyholder, you're seeing some savings on your auto insurance premiums. And that is what's happened over the last year. But in creating that savings, the legislators also created some serious problems that your listeners would know about if they or a family member have ever been injured in an automobile accident. Automobile accidents, affect everybody, including young people. And so we've got a lot of auto-injured patients who have really received a disservice from the legislative changes that happened about a year ago. And what that happened was, and this was a late night last thing that got put into the legislation, that essentially cut the reimbursement that home care companies providing the needed services for severely auto-injured patients by 45%. And what it did is it put the reimbursement level below a level that an agency or others could hire an employee and sustain that employee. And so we've got a serious problem. And what our organization is doing now with MHA is we are working directly with legislative leadership. This is at the state level right now, in order to fix some of the problems that happened in the recently passed auto insurance reforms. And In the meantime, we've got some of these patients who are going into, instead of their home,
Yes.
they're being displaced into a nursing home
True.
or into a facility.
Yes.
Or in some cases, they're going to the emergency room of hospitals.
Exactly.
And so we do have a crisis here,
Yes.
and it essentially is coming up with a mechanism so that we're not cutting services by so much
Exactly.
that we're not able to provide the services that an insurance company is obligated to pay by contract.
True.
You
True.
have your auto insurance policy.
Yes, sir.
That guarantees you
Absolutely.
certain benefits.
Yes, it
and
does.
so this is one of those situations where we're probably still a few months away from really resolving it, but
Yes.
we have been very actively lobbying our legislative state officials, and we're hopeful and confident that
Absolutely.
over the next few weeks that we're going to resolve this.
Indeed.
It certainly is a business issue
Yes.
for the agencies that provide this care,
Yep.
but it is a very emotional and serious issue for the families and the
Yes.
patients who are auto injured and are finding that they can't get the care
Absolutely.
that they need in many cases to survive.
You got it. Absolutely.
There have been some deaths
Yes.
associated with this, and it's just something that we've got to fix.
Yes, we have to. We have to, Barry, and it's a double whammy, right? A double whammy in that respect. In that respect, that a auto accident is already a traumatic incident that results in a lot of injuries, and people really do need the care, and then families need to have the peace of mind that the care is affordable, because there's already a loss of income for the individual, if they were of working age and are disabled. So a lot of challenges there, Barry, but glad that MHA is being a champion, a champion for the voiceless in this respect, and we're going to keep on pushing. Right? We're going to go to a commercial, and we'll talk more about how MHA and Barry Cargill positively impact stakeholders in the state of Michigan. We'll be right back. I am Dr. Cleamon Moore, President and CEO of American Advantage HomeCare. American Advantage is a Medicare certified provider of skilled home health care service. It's fall season in Metro Detroit. The leaves are falling and so is the temperature. But what is rising? Our commitment and passion for homebound patients. Don't just take my word for it.
Speak up while you're in the hospital. American Advantage Home Care is where you need to be.
Gus knows home care. Trust Gus and call us today. Welcome back to Season 1, Episode 18 of the Home Healthcare Today show. We're joined here with Mr. Barry Cargill of the Michigan Home Care and Hospice Association. And prior to our commercial, Barry was sharing with us some of the challenges presented by changes in auto insurance laws and legislation. And we want to pick up there, Barry, not only the auto accident victims, but talk to us about other stakeholders. How is MHA able to successfully continue to provide value and positive impact to its stakeholders?
Yeah. Well, what we do is we bring all of the agencies like yours together, so that that you're not an island.
That's
the
right.
problems that you're facing, most of them, 90%, are being faced by every other agency that's out there. And so we help bring the industry together to solve common problems. And I tell you, the opportunity that is there, and what we try to do, and through education and advocacy and working with our members, is to grow your business.
Absolutely.
And ultimately to solve the problems
Yes.
that people have
True.
who need care.
Yes.
And people are living longer. I mean, it's
got it.
just a fact.
It is.
It's not unusual for somebody to live into their late 80s and 90s. And if you look at the trend, you'll see that just each decade, you
Absolutely.
see a significant increase to that. And I would expect in the future we'll see more.
Oh,
But with that, you also see the inherent problems
True.
with a population that is that old.
Yes.
And while they're living longer, they also are having medical needs that need to be addressed.
Absolutely.
In many cases, it's mental health issues, they're physical as well. And while home care is for all patients, we basically help people stay out of the hospital or to not return to the hospital or to get out of the hospital sooner.
Absolutely.
And we're able to do that by keeping them in their home. Between now and 2035,
Yes.
the baby boomers are going to continue to increase the need for home care.
True.
In many cases, if a senior in their 60s and even early 70s are not the primary candidates for home care. It's when they get into their late 70s, into their 80s, their 90s, and
Yes.
For a few of them out there, even beyond that. And so, being able to provide the services that someone needs to do that they can't do for themselves helps them stay in their home, where statistics show that's where they want to be.
It is.
If given a choice, they want to be in their home for as long as they can. And home care helps them do that. In some cases, it's what we call private duty care, which essentially is the services of daily living that someone needs. Some people will call it personal care.
True.
In some cases, it's just helping them with their meals. It's the companionship that they need. It's somebody in the house to know that if you fall, that there's somebody there to help.
Absolutely.
In some cases, it's assistance in getting into the bathroom or to take a shower or to prepare your meals or to sometimes even get in and out of bed.
Absolutely.
And without those services, in many cases, your only choice is to go into a facility.
It is.
And facilities are good as well, and in many of those are becoming more and more like home as people do want to exercise their choice to stay in their home.
Absolutely. Yes.
And as we're looking at the aging baby boomers, the opportunity for home care agencies and the needs of an increasing population is going to continue to go this direction.
It sure will.
Before it goes the other way.
Yeah.
And between now and 2034, it is going to go up.
It will.
As the senior population ages and as their needs for home care increase.
Definitely.
So
Barry.
between now and 2034, the need will be significant. And how we do that.
Yes, and Barry, that's why as we think about National Home Care and Hospice Month, and really focus on seniors of today as well as seniors of tomorrow, and the needs that seniors are going to have, you have to put this in layman's terms of if we have an aging, and we do, it's not an if, we have an aging population where the senior segment will outpace the 0 to 5-year-olds, right, from a generation standpoint, to the tune of about 25% of our population will be at that senior age or senior citizen age. Numbers, right? So if we are a population of 360 million, that's about 90 million seniors. So from a institutional standpoint, the nursing home infrastructure perhaps is not the most feasible option for a quarter of our population. So aging at home, aging with dignity, looking at ways to add more technology to homes, providing greater access, whether it's renovations inside of a home, right? Whether those consultations that families begin preparing for now we're adding a room, we're widening our hallways, right? We are making our restrooms more accessible with walk-in showers and the like. Exciting times ahead. And from a national or from the standpoint of a nation, we haven't necessarily received the best reputation for how we've treated our seniors or how we treat the elderly. So, Barry, thanks for helping to change the mantra of how our country has been viewed as in respect to our seniors. And they did it for us. We owe it to them, big time.
Yeah, and that's an important role for MHA and the association to promote and foster best practices.
Yes.
So that we can build the trust with the seniors and their families.
Yes.
The sons and daughters out there are often the ones helping to make decisions for mom and dad, and they want to know who's taking care of mom and dad.
Absolutely.
And from that standpoint, what the association does is through education and advocacy, we promote best practices.
Yes.
if somebody is going to be taking care of your loved one, you want to know who they are.
You got it.
And having the data available, having the information available so that you can make that assessment.
Yeah.
And it's not unusual that somebody making that assessment might be in New York.
Yes, so true.
Mom and dad are here in Detroit.
Right.
Mom or dad,
Yes.
or both. And so it's really important, I think, as an industry association that we help agencies rise to the top.
Absolutely.
Organizations like yours who are doing extra things in order to develop trust and to develop the policies and procedures that can essentially give assurance to the patients and their families
Absolutely.
that the care you're giving them is the best.
Indeed.
And that you're able to do that in a way that they have confidence.
Yes, sir.
That the people providing that care know what they're doing and have compassion and skills necessary in order to be effective and to do the best job possible to keep people in their home.
Absolutely, Barry. Barry, a couple more questions. I know you got some pressing things later in the day, and we got another segment of this great episode. I'm having a good time with you, Barry. Success is never achieved alone in our industry. So, as you mentioned, the policy makers, legislators, lobbyists, right? The workforce community out there, the skilled home health care providers are also important, including the physicians who write and sign our orders for home health care. Barry, in view of MHA, right, and having such a challenging role as president of an agency that's statewide and is so vital to the future of our seniors, if you could have a big ask, right? Big ask for listeners, viewers, or the networks that listeners and viewers are connected to, what would be that big ask? And how could that, if granted, how could that big ask elevate MHA?
Well, let me lay out the platform first.
Yes, sir.
And then I'll let you know what my big ask is.
Okay.
And it is a big one. First of all, we've talked a lot about what the need is.
Yes.
I mean, it is going to be an increasing need as baby boomers age and need more than what they and their families are able to provide in order to keep them in their home. We need a healthcare system that can help support that. And, our nation has been so divided on what the solution is.
True.
We need people like Congresswoman Dingell and others to really be fighting for us on this particular issue. And long-term care insurance is one of the solutions.
It is.
But long-term care insurance has not been working very effectively.
Yes.
And it's because the insurance companies that offer that kind of care don't know what the rules are.
True.
We don't know if we've got nationalized health care or we have a market system.
Yes.
And it could be a long time before we actually get that solution. We need lawmakers to figure that one out. And the big ask is that we fully fund Medicare so that Medicare is there and able to provide what is needed for this huge and increasing senior population.
Indeed.
Who's aging. We've got a system where, think about it. Those who pay into Medicare are the taxpayers.
Yes.
And those taxpayers are retiring at a pretty rapid rate to where a large share of the population is now no longer paying and soon is going to be a taker from the Medicare healthcare system.
Absolutely.
The payers are going to be, those who are still working, and that number is much lower. So it's not sustainable right now. We need to really figure out how we're going to fund Medicare into the future, really between now and 2034.
Absolutely.
And along with that, what are the rules for health care going forward so that some of the things like long-term care insurance and health insurance can help be a part of that solution while we're trying to figure out how do we sustain the Medicare system in order to work it in.
That's a big one, Barry. That is a huge ask. And some of the low-hanging fruit in that, we do want to make sure that our seniors can get hearing aids, right, that are affordable and accessible, hearing tests, we want to get that covered. And definitely dental work for our seniors. These are obviously a need, the loss of hearing, from a sense standpoint, but teeth, yes, the need to be able to eat, right? And the dignity that comes with having, a good set of teeth as well as the ability to hear. So we want to preserve the dignity and keep fighting the good fight. Barry, last question for you. Last question. All right, Barry, what are ways that people could, join, contribute, help? I know we had a real big ask, but for the layperson out there listening and hearing, say, all right, November is National Home Care and Hospice Month, and hey, I want to do more to help. What can they do?
I think for agencies, of course, it's to join the association and be part of the solution, help improve the industry. But for, I think, most of your listeners out there, it's the patients and families. Absolutely. And what can patients and families do?
Yes.
Families are an increasing, have an increasing role in taking care of those seniors.
Yes,
in some cases, technology is needed. Son or daughter is not necessarily in the same home.
Yes.
They may be down the street, or they may be in California.
True.
It's advancing technology to help in home care. And I think as we move forward, I think the biggest part of all this is the role that the family plays in providing care, in working with the home care company that provides the professional services when family is not able to do it all.
Absolutely.
Or when the patient is not able to do it all. And in some cases, it's not really a patient, it's a client.
True.
Because not only are we talking about medical needs, but in some cases, it's just simply the services of daily living. The things that an aging senior is not able to do with themselves in order to stay in their home. That's what it's all about.
It sure is.
And I got to tell you,
hey, talk to me, Barry.
You can take care of my mom and dad any day.
Barry, my
and
man.
Someday me.
No doubt. Barry, thank you so much for trusting American Advantage Home Care, right? That's a outstanding endorsement. We appreciate it, Barry. You've been gracious, with your time and your insights. And together, Barry, not only will we continue to honor November as National Home Care and Hospice Month, but I'm willing to push it and say every month should be Home Care and Hospice Month. Barry, thanks for joining us today.
Thank you.